It's been nearly 4 years since the first case of COVID-19 was discovered in the U.S., but the country's former top doctor believes the federal government is still not acting fast enough to protect Americans from the virus or another pandemic. Dr. Jerome Adams is the former U.S. Surgeon General.
He has a new book called Crisis and Chaos: Lessons from the Front Lines of the War Against COVID-19. In it, Adams explains how we can respond better to the next threat. Dr. Adams, thanks for being with us.
Hey, it's great to be with you. Happy belated Thanksgiving.
To you as well. So you were running the Indiana Department of Public Health under Mike Pence before President Trump pulled you up to the top medical spot in the country, and then COVID hit. With the benefit of hindsight, are you surprised at how political it got, and then the impact of that politicization on our response to this deadly virus?
Well, that's a great question, and it's one of the main points of my book. We need to acknowledge how political bias impacts our ability to assess health information objectively. And as you mentioned, I was health commissioner. I was just the second Surgeon General in history to have run a state Department of Health before becoming Surgeon General. And we had some contentious issues in Indiana. We had an HIV outbreak. We had a lead contamination situation in East Chicago, Indiana, just south of you all up there in Chicago. So I knew that politics and communication were going to be a big deal, but no one could have anticipated having a once-in-a-century pandemic superimposed on top of a presidential election. And oh yeah, we had a social justice movement, the likes of which we haven't seen since the 60s at the same time. And it made it incredibly difficult to actually have real conversations with people about the root issues.
And of course, hindsight is 2020. But what were some of the biggest, things that we learned from living through COVID?
Well, I'm so glad you asked that question, because that's really what the book is all about. It's that we keep making the same mistakes over and over because we aren't focusing on the root issues. And I want to give you a really quick story. October of 2020, Joe Biden and Donald Trump were having a presidential debate. 200,000 people had died. We didn't have vaccines. We didn't have home testing. We didn't have treatment yet. And Joe Biden said any president responsible for this many deaths should resign. You can look it up if he actually said it live on TV. Well, fast forward to the end of 2021. Joe Biden was responsible for about 360,000 deaths. And I don't say that to criticize Joe Biden. I say it because if we continue to focus on who's in the White House and not what the root issues are, we're going to continue to suffer. So really quickly, we need to improve public health infrastructure. We need to make sure we improve data reporting, that we have communications help for people. One of the things I often tell folks is that I was trying to be Surgeon General of the United States and run a 6,000 person Public Health Service Commission Corps. And at the same time, I didn't have full-time comms help. I was composing my own tweets. I was trying to come up with my own messages for the media while running a 6,000 person company.
But Dr. Adams, to your point, you talk about the deaths under Biden versus the deaths under Trump, but many medical experts have said part of the reason we continued to have so many COVID deaths after vaccines rolled out was because of the vaccine skepticism that was bred and fueled and fanned by many members of the Trump team.
Well, and it's something that I also point out in the book. We act like vaccine hesitancy is new. We almost lost our measles eradication status in 2019 before COVID because of rising vaccine hesitancy. This is something that's been building, and of course, it combined with politics in 2020. I'll also point out that the Trump administration, and again, this is not trying to be political, but they actually developed the vaccine in record time. So we need to make sure we're working to help people understand that vaccines are safe, that they're effective, and that's in all communities. The African American community has high levels of vaccine hesitancy, and they certainly don't tend to vote Republican. So I think we have to try to avoid as much as possible looking at this in political terms and really understand the root causes of people's failure to take health measures that will help keep them safe.
And just real quick, do you think that there is another pandemic that is approaching soon? And if, how quickly should we be acting?
Well, it's not if, it's when. There's actually a big respiratory virus that's circulating in China right now. that people are worried about. We had mpox again. Again, that's the whole point of the book is if we don't confront and rectify these long-standing health inequities and public health infrastructure issues, we're going to continue to have the same problems over and over again. It doesn't matter who's at the White House or who's running the CDC or who's the Surgeon General. And we keep seeing that play out. And that's why I want people to check out the book, because I want people to be able to protect themselves moving forward and to understand how we can all do better.
Yeah. Dr. Adams' book is called Crisis and Chaos, Lessons from the Front Lines of the War Against COVID-19. For more, you can check out his website and follow him on X. Thank you so much for joining us this morning.
Hey, thank you all. Take care. Have a good weekend.
Be well. Thank you.